Hello, my name is Suzanne Hinchliffe. I'm the Chief Nurse and Deputy Chief Executive of Leeds Teaching Hospitals. I'm also the SRO for the local maternity system for West Yorkshire and Harrogate. I have been asked to introduce this film to inform the maternity workforce, which includes all partners across health and social care, about maternity transformation and the development of local maternity systems across Yorkshire and the Humber. The National Maternity Review took place in 2015 and was published in 2016 as a document, Better Births. The review was undertaken as a response to the need for improvement in maternity services and involved talking to women, their families and staff across England. Better Births identified 7 key themes to improve outcomes for women, babies and their families, and led to the establishment of the Maternity Transformation Programme. I'd now like to introduce an animation followed by staff experiences about the LMS.
The LMS is a system-wide approach which includes health and social care commissioners and providers, women and their families, working together to develop services across the whole maternity pathway, including preconception, keeping the health of women and their families as their focus. It responds to the transformation laid out in Better Births. It also includes looking beyond boundaries to provide care which is more personalised and safer. In England, there are 44 LMSs. 3 are in Yorkshire and the Humber. These are Humber, Coast and Vale, South Yorkshire and Bassetlaw, West Yorkshire and Harrogate. Each LMS has a single vision and work together to improve safety and choice for women, their partners and families. The partners are maternity services, neonatal services, commissioners, women and their families, mental health providers, public health, local authorities, primary care, independent midwives, voluntary and community organisations, community services, ambulance services. How does it work? The local maternity system LMS board is responsible for governance and decision making for the LMS, including the monitoring of plans. Membership of the board includes senior clinicians, commissioners, women, public health, clinical networks and ambulance service. Each has developed a detailed plan to show how they will implement Better Births. All LMSs are working towards the ambitions set nationally and locally to provide personalised and safer care. There are a number of implementation groups which report to the board. These groups will carry out the work needed to make the LMS plan a reality. Better Births highlighted the importance of listening to and working with women and their families to co-produce services. A model for maternity voices partnerships, also known as MVPs, has been developed. The LMSs will work alongside national quality improvement programmes, such as the Maternity and Neonatal Health Safety Collaborative, saving babies' lives and avoiding term admissions into neonatal units. The LMSs will improve services not only for women and their families, but for the maternity and wider workforce. For more information, please contact your local programme lead.
The West Yorkshire and Harrogate LMS is based on one system with one ambition, and that's ensuring that we help transform services for women, but also making sure it's a safe and enjoyable place to work.
Staff and women are at the heart of LMS design and delivery, and they have been from the beginning. Change will take place with staff, not to staff.
We're not reinventing the wheel, but we're building on the great work already undertaken in West Yorkshire and Harrogate.
We're all members of the LMS, staff, women and families. It's our responsibility to understand the values and the vision to make that happen. So it's really important that we talk to each other and we share what is happening with our friends and colleagues.
Personalising women's care is a priority, providing bespoke services which meet the needs of women and their families.
The changes will mean that women will have more choice of what's available to them across the LMS. And staff need to also be aware of the different services that are available to women across the LMS, to really inform them about what kind of choices they make, to take into consideration and ensure the safety of their babies and themselves.
Together, we will ensure that quality improvement is a day-to-day activity in all areas and across all partnerships within maternity services. And we are keen to continue to embrace and develop a culture of learning, and also in sharing best practice to improve the quality of care and also the outcomes for women and their families.
We will provide continuity of carer, learning from previous mistakes and understanding how we have worked in the past. We will work in partnership with women and staff to develop models of care.
Of course, with better births, there will be changes in the way that we deliver maternity care, but we will continue to do what we've always done well for women and their families, and to put women at the centre of each local maternity system. The local maternity system should be a part of everybody's practice in maternity services. It's everybody's responsibility to know what their LMS is all about and to buy in to working within the LMS to deliver an excellent service for women, but also to give them a good experience. Every LMS has one ambition and has one goal, and that's the safe care of women, their babies and their families.